Good morning. This is Dr. Kari Simonson joining you on June 26, 2020 for your COVID-19 update from Children's Hospital and Medical Center. This week we have a couple of ongoing efforts and some updates on best practices that I want to remind you of. So I'll start off with masking. And while universal masking has been around for a while now here at Children's, it still might not feel like a normal routine. And we're all still kind of building and reinforcing this habit, both at work and out in the community. So I want to remind you to be diligent about masking, including wearing your mask or a cloth face covering when you're going back and forth from the buildings out to your car, for example, and when you're out and about in public. This really exemplifies for us that we're a team as part of a healthcare organization and that we want to role model this practice as a public health effort in our community. Ultimately, it's about doing what we can, doing the right thing to protect our patients, our families, and the community, as well as each other. And that safety remains our top priority. So thank you. Another update that has been very exciting is that we're getting additional testing mechanisms in-house for COVID-19. They will start becoming more available over the next week or so. One of the first areas with increased test capabilities will be our surgical and pre-procedure areas. So I really want to thank the CARES and pre-op area that have been working this week to pilot this process and start getting things ready for complete rollout. There will be other processes being rolled out in additional patient areas and outpatient areas coming soon. And a pilot of rapid asymptomatic testing is underway right now. This is going to help us with kind of just-in-time testing and eliminate barriers for patients and families as they arrive for care that's needed at Children's. So thank you to all those teams who are working hard in the lab to get these tests up and running and in the clinical areas to develop policies and procedures for best use, and additional guidance and specific ordering information will be forthcoming soon. Another group I want to speak to are those among our Children's colleagues who are still working remotely. It's been a safe, workable option for many staff members for the past 3 months, and we really appreciate everyone's flexibility as we're trying to safely and wisely manage our human resources during this evolving pandemic. I want you all to know that Children's leadership is evaluating ways to safely bring back some of the workforce and trying to think through what are safe, logical, and thoughtful means to do so. As you can imagine, there are lots of factors and questions to consider, as well as the changing conditions of the pandemic within our local community. So I want you to know that we're collaborating, we're listening to leaders on this issue and hearing from our department areas. Active discussions are underway, but things are not being rushed into. We will be providing additional communication in the upcoming weeks around when we think further guidance will be available for the organization and what those next steps will be toward bringing more of the workforce back on site. So stay tuned and know that this is being done thoughtfully and carefully. And lastly, for this week, I want to remind you of our theme with our new hashtag, Children's Strong, for the year. Take a look as you're driving or walking by that it's now proudly proclaimed across the 84th Street Sky Bridge. This idea for Children's Strong really honors the strength, dedication, and resilience of the team. And this is definitely an idea I can get behind because honestly, I see that demonstrated in this organization every single day. So thank you for being Children's Strong for our patients, our families, for one another, and for the community. That's your update for the week, and thank you again.